How does bladder management relate to the genitourinary system? Have you ever wondered how bladder management connects to the genitourinary system? The bladder plays a vital role in this system, which also includes the kidneys, ureters, and urethra. Together, these organs are responsible for producing, storing, and eliminating urine. Keeping the bladder functioning properly is crucial for urinary health and can help prevent serious issues like bladder cancer. The bladder's main job is to store urine created by the kidneys until it is ready to be released through the urethra. Effective bladder management is all about ensuring that this process works smoothly. This involves a complex relationship between the bladder muscles, the nervous system, and the structures of the urinary tract. The nervous system, especially the spinal cord and peripheral nerves, is essential for controlling how the bladder fills and empties. It does this by coordinating muscle contractions and the relaxation of sphincters. When there are disruptions in this control, such as from neurological disorders or spinal cord injuries, it can lead to bladder dysfunction. This may result in urinary retention or incontinence, both of which can increase the risk of infections or even bladder cancer. To manage bladder health effectively, various strategies are used to help maintain or restore normal function. These strategies can include behavioral techniques like bladder training, clean intermittent catheterization, and indwelling catheterization. In some cases, surgical urinary diversion may be necessary. The choice of management strategy often depends on the specific cause of the bladder dysfunction and the overall health and mobility of the patient. For instance, in patients with spinal cord injuries, clean intermittent catheterization has become a preferred method. It balances effectiveness with a lower risk of complications compared to long-term indwelling catheters. As mobility declines, urinary diversion methods may also be considered more frequently. When it comes to bladder health and the risk of bladder cancer, proper management is essential. Chronic urinary retention, repeated infections, or prolonged use of catheters can lead to bladder irritation and inflammation. This can potentially increase the risk of developing bladder cancer. Regular assessments, such as urodynamic studies to evaluate bladder function, along with timely interventions and lifestyle choices like staying hydrated and maintaining a healthy diet, can help reduce these risks. In summary, bladder management is closely tied to the genitourinary system. It involves ensuring the bladder can effectively store and expel urine, relying on the coordinated function of the urinary tract and nervous system. Proper management not only supports bladder health but also plays a critical role in preventing complications and addressing the needs of patients at risk for bladder cancer or other urinary disorders.